Good afternoon and welcome everybody. I'm Dr. Biricotti, I'm surgeon, and today I speak about volumetric fascial restoring, jawline and tear through. So fascial anatomy, the fascial, it extends from lower border of mandible and to the hairline. Forehead is common for face and scalp, and it extends laterally to the ear auricle. Layers of the face are that the skin, it is thick, has a rich blood supply, so rapid healing. And superficial fascia contains muscles, vessels, and nerves of the face. No deep fascia in most of the face to allow for facial expression. Facial muscles, the thin, flat muscles connected to the dermis of the skin, innervated by the facial nerve, considerable individual variation, often blend into each other. Relaxed skin tension lines run perpendicular to the direction of muscle fibers. So, forehead muscles, frontalis, procerus, corrugator superficially, and orbicularis oculi. Nose muscles are nasalis, depressor septi nasi, and levator labii superioris, aliquo nasi. The lips muscles, we can divide it into three groups. The first group are the muscle insert into medialus, group 2 insert into upper lip, and group 3 insert into lower lip. And the nerve supply of the face, we can divide it into two branches, sensory and motor. For the sensory, by branches of trigeminal nerve, except the skin covering the angle of mandible, supplied by the great auricular nerve. And we can divide the sensory nerve in three branches, so ophthalmic division, maxillary division, and mandibular division. For motor, by facial nerve, which supplies all muscles of the face except the levator palpebralis superior by oculomotor. And we can divide the motor nerve in 5 branches. So, sensory supply, sensory branches of the trigeminal nerve course superficially are prone to damage. So, however, most of the resulting sensory dysfunction is not debilitating because of collateral sprouting of nerve-sensory nerves. Knowledge of sensory nerve anatomy is useful for regional anesthesia and nerve blocks, so very important in the activity of surgeon and medical treatment. Artery supply. The face is supplied by branches of the external carotid and internal carotid artery. So two main branches of the external carotid, facial artery and superficial temporal artery, and main branches of the internal carotid that supplies the medial upper face and scalp is the ophthalmic artery. In this image, we can see the masseter muscles and the facial artery and facial vein that are very, very important because this structure determines the deadline for the doctor, for the surgeon. So it's very important to know this to avoid the important complications like ischemia. So in this image, we can see the ischemia after treatment, after injection of hyaluronic acid into the vessels. So what happens over the years? In the face and in the exposed area of body with the passing of the years, involuntary changes happen, such as photoaging induced by solar radiation and muscular aging, the structural modification of muscle fibers. So all this happens together with the physiological chronoaging present in every individual and dependent on genetic characteristics. So with aging, we are witnessing a structural failure of the whole body, characterized in the woman from ptosis of the face, of breast and abdomen. But this also happens in a man, so like famous actors like Arnold Schwarzenegger or so on. So What to do? Stop the time. This is the answer, but it is impossible. So the main concept that the doctor has to be is the harmony. The concept of the measure and correctness proportion is fundamental to correct the photoaging and the aging. So the structural change in the face with age, the first is that the skin and subcutaneous tissue thin, volume decreases muscle tone, and change the projections. In this image, we can see the decrease in bone tissue of the patient, decreased soft tissue quality, and decrease in projection. So the molar eminences has a double function, the physiognomy and structure. On the face, if the bizygomatic diameter is greater than the bigonial diameter, the image of the face is projected upwards and the appearance is more youthful. So we must reverse the triangle to return to a younger face. Solution. So surgical treatment or medical treatment. In surgical treatment, we can do lifting, lipofilling, prosthesis implant, and in medical treatment, filler, Botox, and so on. But what are our patients looking for? Absolutely improving their face and their body, but with safe and non-invasive method, with a rapid resumption of the daily activities. So in my opinion, I think that for the patient, the first treatment to do is the medical treatment. Management pre-treatment. Which volume does the patient wish? How many vials are necessary? How many treatments are needed? So it's important to make clear the limits of the method regarding the achievable results. Calculate the necessary number of vials and their distribution. Plan largest increases in more subsequent treatments. So what to do? First step is restoring face volume, injecting volumetric fillers into specific areas of the face, like zygomatic arc, jawline, and mandibular angle. In this way, a medical face lifting is obtained. Step 2, fill deep lines, erasing the sides of the triangle, obtained the total reverse of the triangle, like tear through, temples, low lines, and marionette lines. So this is my patient, is a female of 77 years old, and we can see in down image before the treatment and upside after the treatment of the facial restoring by the fillers. Second patient is female, 42 years old, and we can see before and after volumetric facial restoring. In this patient, I perform a treatment of the zygomatic arc, the jawline, and the chin, and the superior lips to change and to give a new harmony. So, jawline. For restoring the jawline, usually we have to perform the treatment using 5 point of access point, 5 areas of injection. The first is the mandibular angle. The second step is the areas above the mandibular angle. Third step is the medial line of the jawline. This is in red. The color is red because this is very dangerous area because here there is the fascial artery and fascial vein. So it's very important to have very careful. The step 4 is the point below the marionette line, and the last point is the chin. So in the other slide, we can see the same picture, but without the skin. So it's very important that in the third point, don't use the needle, because it's very important, don't create a damage of the artery, of the fascial artery. So usually the third point I perform by a cannula 25 gauge cannula and not the needle. So this is the patient before and after treatment, in which we can see the difference after the treatment of the jawline. So mandibular angle, medial jawline, and the chin is very important. Second patient is the same, very important, the change after the treatment on the chin. And the line of the jawline is very straight and not like before the treatment. And the last patient in which I perform a treatment of the zygomatic arc and jawline with the angular of mandibular and the chin. Okay, so the second chapter of today is the tear throw. A tear throw is a deep crease between the lower eyelid and upper cheek. It can cast a shadow below eyes, resulting in a tired appearance. So in certain individuals, tear throw are an inherited trait. In others, tear throw become more prominent with age. So the goal of the tear throw filler is to reduce the depth of a tear throw. But very attention that the tear throw fillers aren't FDA approved in USA, and their use is considered off-label. So it's very important from point of view of the insurance. So very attention to this treatment. The use of cannula 25 gauge is fundamental for this type of treatment to avoid hematoma, ecchymosis, and the pain of the patient. This is the treatment. So we can see before and after treatment. We can see the tear throw in the image and after treatment, that the tear throw is very, very, very small. Other patient, the same treatment by cannula, and another patient before and after. And one more. Okay, so this is my presentation, and I think that